Hi, this is Joe Feeks, editor of Pig Health Today, and with me is Dr. Paul Yeske of the Swine Vet Center in St. Peter, Minnesota. Great to see you, Paul.
Good to see you as well.
Now, I think everyone will agree that 2020, and particularly the second quarter of 2020, was a pretty dark period for the pork industry. And, we saw a surge in plant shutdowns, and that was in all the hog producing states, but it was particularly acute in your clinic service area, namely Minnesota, Iowa, and South Dakota. I really want to focus on some positive lessons that came out of COVID-19 and not get into a lot of gloom and doom, but you had a front seat for this crisis. What was it like for you personally?
Yeah, I think unfortunately we were in the middle of the first plants that ended up closing, and so that certainly offered a bunch of challenges because nobody really knew what was going to happen. Number one, we didn't know they were closed indefinitely. We didn't know what's indefinitely mean, and that was one of the challenges because you really couldn't plan around it. He didn't know if it's going to be 2 weeks or 4 weeks or 1 week. And so that made it a bit more of a challenge right away. And then as more things started to happen, people learned how to manage it more. The plants learned how to manage it more. I think that helped further down the road for people that were involved later. But early on, it certainly was frustrating just because of a lot of unknowns. And I think that was probably the biggest concern was, number one, we didn't know when the plant would open again. Number two, we didn't know what capacity they would come back. And so that made it very stressful for clients. I think we learned just how good a system we had on a just-in-time delivery, in the fact that producers and packers alike had been incentivized every step along the way to make the system more efficient and to have no slack in the system. And all of a sudden we had the system shut down and we didn't have anywhere to go with the pigs. And so that became a real challenge. We had a very nicely designed and operated just-in-time system, and all of a sudden we couldn't operate it, and then the wheels came off the wagon pretty fast.
This must have been terribly frustrating for your producers because it's just in their blood to want to be efficient and provide good welfare for the pigs, and now all of a sudden they're being asked to hit the brakes on growth. And worst case scenarios, of course, they had to look at euthanasia.
Some of that happened there just in slowing the pigs up, and the pigs are still there. We just didn't have as many pounds, and so we still had the issue with of getting rid of the pigs. And unfortunately, producers had to struggle with that hard decision of euthanizing pigs and clearing some space that way. And so that was certainly difficult. I think no one understands just how hard that is on the people until they have to do it. And no one can really appreciate that until they have to make that decision, until they have to actually physically do the job.
And you really can't plan for this, can you? I mean, you could have had a plan that was all written down and buttoned up, but then having it in writing and then experiencing it are two different things.
Absolutely. I think one good thing that happened to us, if you had to say there's any silver linings to it, is in 2019 there was a tabletop exercise and a full exercise looking at a foreign animal disease event. And USDA put that on, and they did a nice job putting it on. And that's exactly what you said is true, is we did a lot of planning, talking about how you do it. But when we did it, it was totally different than what we planned. And some of the things we thought we knew, we didn't. And so I'd say today, we're probably better off to handle a mass euthanasia if we have to than we were before. And so that's one of the good things that came out of the situation. I mean, when you have to do a mass depopulation, you have to look at, number one, how do we do it in a humane way? How do we do it in a safe way for the people? And how do we deal with the numbers? And so those things are all considerations that are different than when you think about euthanizing one animal. And I think everybody's experience was more about euthanizing one animal or a few animals. When you get to the mass depopulations, it's a different debate.
Yeah, and let's talk about that a bit, because I think in Minnesota alone, there was something like 350,000 pigs that were euthanized. And at that point, I would think that you just go numb. I mean, you've got a job to do, you have to move forward. But you also obviously got a lot of practice. What sort of innovations emerged from this unfortunate experience?
Ventilation shutdown was one of the things they'd used in avian influenza breaks, and certainly was used here as well. But it's not as easy as you think. And so there were some things that we didn't think we'd ever learn, like how to that you can get steam boilers that you can pull onto a site if you need to, and you can increase the heat in the barn when needed. But those are just some of the things in the process of doing it you have to learn. And the CO2 trailers, the dump trailers with CO2 came along later on. Early on, there was some concerns because there wasn't as much CO2 available because the ethanol plants were shutting down. And so as time went on and they came back up online, then there was more CO2. Minnesota set up a couple of composting facilities that were set up by the state and were available to be used. And so again, in a foreign animal disease, we probably won't have that type of situation. But here we were able to utilize that, and it was very helpful to centralize that so everybody didn't have to do their own. When the plants were shut down, then some of the things that come out of the packing house and go to rendering weren't going. And so that gave us the opportunity to have a little bit more capacity, and the timing helped that they didn't stack on top of each other, so that we were able to get more products through rendering than we thought. The restaurants shutting down also reduced some of the stuff going through rendering. And so there was a little bit more capability probably than anybody had thought of, but we were able to get a lot of them through the rendering process as well, which was good. Then there was value in the product.
You also mentioned that, of course, depopulation can be a blessing of sorts because it forces you to hit the reset button on your herd health program.
Yeah, absolutely. And we did see some of that happening with some herds that were having some specific health issues. They made the decision to depopulate. If we're gonna work with pigs, let's work with healthy pigs.
Now, obviously, we were dealing with a human disease here, not an animal disease. But having gone through this experience, have you learned anything that you can now apply to your day-to-day practice for managing day-to-day swine diseases?
I think versus the general population, I think a lot of the swine producers, they understand a lot of how disease transmission works. They understand a lot about biosecurity, and they understand a lot about what it takes to make a unit biosecure, and the commitment it takes to education and the ongoing training that it takes to make it work good. And you can certainly see it today in the messaging out there on washing hands and wearing masks and all that stuff. It takes a lot of work to get that messaging out there on the biosecurity side, and the swine industry's been working on that for a number of years already. And so I think we do have a leg up there just because we've had to deal with infectious disease for a longer period of time, and I think we've got some good methods. The herd closures have been very effective in helping us deal with some of these disease challenges and issues. So there's a lot of things that we have learned over the course of time that help us manage some of these issues.
When you have situations like this, and whether it be COVID-19 or a bad outbreak of PRRS or another disease, managing morale is so important. I mean, you yourself, you've got to get out of bed every morning and try to keep a positive attitude. And again, you've got your whole team there of professionals at the Swine Vet Center. How did you manage to keep moving forward?
Well, I think it takes a lot of communication in that time frame, and it's a lot of communication and support. I think it's making sure that everybody understood what the goal was, everybody understood what needed to be done, and how can we do it in the best possible fashion. And communicating with the producers and growers. Producers and growers don't like to do those jobs, and so helping that get done, and then just continuing to communicate every day with those people. We spend a lot of time on the phone talking to a lot of people, and I think that's what it takes through those type of things that happen to make sure that everybody's at least understanding what's going on.